Going to talk to you about the skeletal anatomy pertinent to the PENG block or pericapsular nerve group block. The other kind of terminology that's used for this particular block is the articular branches to the hip joint block. To perform this injection, the structures of interest would be anterior superior iliac spine, anterior inferior iliac spine, iliopubic eminence. When we start scanning, we will scan with the ultrasound probe, and particularly using a curvilinear ultrasound probe, putting it on the anterior superior iliac spine. The step 2 would be moving down the probe looking for the anterior inferior iliac spine. As soon as the anterior inferior iliac spine is visualized on the ultrasound image, you will orientate the probe along the groin crease, making it more aligned with the iliopubic eminence. Once you have seen the iliopubic eminence, the soft tissue structure that you'll be able to visualize will be iliopsoas tendon. And this is your target of interest. If you inject the local anesthetic on the lateral aspect of the iliopsoas tendon, that will target your femoral articular branches. And to perform this injection, you will bring the needle in plane just below the anterior inferior iliac spine and parking the needle next to the iliopsoas tendon laterally. If you bring the needle in plane and park the needle medial to the iliopsoas tendon, then you're targeting the accessory obturator nerve that are supplying to the hip joint. So lateral to the iliopsoas tendon, targeting the femoral articular branches. Medial to the iliopsoas tendon, you're targeting the accessory obturator branches supplying to the hip joint. When you go through the tendon, and if your needle is located below the tendon, then there are two structures that you could target. One would be the iliopsoas bursa, and the other structure or the other block would be the PENG block, the pericapsular nerve group block, where when you inject 15 to 20 mL of local anesthetic, not only it will block your femoral articular branches, it will also block your accessory and obturator articular branches supplying to the hip joint. Thank you. So I'm going to talk about the hip articular branch blocks, PENG block, iliopsoas bursa injection. The same scanning technique will be able to identify all these structures. The starting point will be palpation of anterior superior iliac spine. We'll position the probe on the anterior superior iliac spine. We will move the probe quadad looking for the anterior inferior iliac spine. Once we see the anterior inferior iliac spine, we will be lining the probe along the groin crease looking for all the structures of interest. So here I have a curvilinear ultrasound probe. I would recommend using curvilinear ultrasound probe because of the wider field of vision. We're starting at the anterior superior iliac spine. As you could see it on the ultrasound, the anterior superior iliac spine is clearly seen as a black shadow. Followed by this, we're now moving the probe quadad, and then we have the anterior inferior iliac spine coming into the view, and then we'll be moving the ultrasound probe and aligning it to the groin crease, looking for the iliopsoas tendon and the iliopubic eminence, and we have all the structures of interest shown in this image. So anterior inferior iliac spine, iliopubic eminence, the round structure you see here is the iliopsoas tendon. In order to do the PENG block, you will bring the needle in plane, piercing the iliopsoas tendon and going on the other side of the iliopsoas tendon, depositing about 15 to 20 mL of local anesthetic, and that will block your articular branches of femoral nerve, obturator nerve, and accessory obturator nerve. To perform the diagnostic articular branch block of femoral articular branches, you will put the needle just on the lateral aspect of the iliopsoas tendon. To perform the diagnostic block of accessory obturator nerve articular branches, you will bring the needle medial to the iliopsoas tendon, depositing 2 to 3 mL of local anesthetic only. So in terms of showing you the needle positioning, our probe will be aligned this way, and if you're using a radio frequency needle or a nerve block needle, the needle will come in plane, going in from lateral to medial, and you will be depositing some local anesthetic on the lateral aspect of the iliopsoas tendon and some local anesthetic on the medial aspect of the iliopsoas tendon. In order to perform the obturator articular branches and the block of these along with the radio frequency treatment, the structures that you would like to visualize to start with will be the hip joint. Followed by this, you will look for the acetabulum, and once you have spotted the acetabulum in your image, you will then move the ultrasound probe only looking at the acetabulum. Once it's in the middle of the picture, you will see the femoral neurovascular bundle. The lower end of the probe will move more caudad and more medially, and that will show you the inferior aspect of the acetabulum. And here we have inferior aspect of the acetabulum, also known as incisura of acetabulum, and you will be bringing the needle in plane going at the base of the acetabulum. This is the ultrasound image. You will correspond this with the teardrop sign on the x-ray, where you want to park the needle on the lateral aspect of the teardrop because you are interested only in blocking the articular branches and not the motor branches supplying to the hip joint. If you're performing the radio frequency treatment, the needle will be brought in the similar fashion, going in plane from caudad to capillad, and once your needle is in the position, you will do the x-ray, you will perform motor stimulation in order to prevent blocking or ablating the motor branches and only ablating the articular branches supplying to the hip joint.